Hi, my name is Justin. I'm a physical therapist at Hoierppreop Institute. You have been selected by your surgeon to participate in the Enhanced Recovery Program. We hope the following information will help prepare you mentally and physically for your upcoming surgery. So let's get started. Prior to surgery, be sure to complete the preoperative checklist. This includes the following. You will need to complete your pre-op lab work and testing. It is highly recommended that you attend the pre-op rehab class with your family member, caregiver, or buddy. You will receive a phone call from a pre-admission screening nurse or nurse navigator to go over additional information. Be sure to obtain medical clearance from your internal medicine or family practice physician. If instructed by your surgeon, stop anti-inflammatories, blood thinners, fish oils, hormones, vitamin E, or anything that the physician specifically told you. To reduce the risk of infections, the surgeon's office will instruct you to use sage cloths. This will reduce bacteria on the skin before surgery. This will be discussed in detail on your last preoperative visit. Now let's talk about planning for your discharge from the hospital. Your buddy or your family member must be present for training with a physical therapist and then to transport you home. It is not safe nor recommended for you to go home alone. Your buddy should be available 24 hours per day for the first 2 to 3 days, and together you will learn what you will need help with and what you can do independently. For your safety, the surgeon or physical therapist will recommend home health physical therapy or outpatient physical therapy. Your therapist will also recommend the appropriate assistive device such as a walker, crutches, or cane. This particular assisted device will be provided to you by an equipment provider prior to your discharge from the hospital. If you already have a walker, crutches, or cane, please have it available in your vehicle. Your therapist will ask for it during your physical therapy evaluation and measure it to your height. Once at home, you will receive a follow-up phone call from your surgeon's team to follow up on how you are doing. Let's go over nutrition. Eating well-balanced meals before and after surgery is important to lower the risk of infection. Be sure to meet your daily protein needs to ensure that you are obtaining the proteins needed to rebuild your tissue. Consume adequate fiber to help keep you regular, because anesthesia and pain medicine can make you constipated. Avoid crash dieting before and after surgery to ensure that you have adequate nutrients and energy for recovery. If weight loss is recommended prior to surgery, no more than 1 to 2 pounds per week is suggested. Stop smoking at least 30 days prior to your surgery. Smoking can increase the risk of blood clots and infections. Now let's review the importance of hydration. Hydration is important in keeping up your energy and flushing your system to help your body heal. Drink a minimum of 8 cups of non-caffeinated, non-alcoholic beverages daily. You may have clear liquids, including Gatorade, up to the time you head to the hospital. Additional fluids that are allowed and not allowed are listed in the table. Please be warned that if you drink any of the not allowed beverages, your surgeon may opt to cancel the surgery. To prevent postoperative nausea and lethargy, we ask that you follow these guidelines. Please purchase Gatorade or an equivalent sports drink a week before your surgery. 1 day before surgery, drink 2 cups of Gatorade or equivalent sports drink 8 to 10 hours before your surgery. On the day of surgery, drink again 2 cups of Gatorade or equivalent sports drink prior to leaving the home. Home preparation is another important topic. Success is when preparation meets opportunity. So it is important how you will safely get into your house. If possible, be sure to choose the shortest distance, a level surface, the least amount of steps or stairs to enter the home. Be sure to remove any loose rugs and clear any obstacles. For your safety, consider purchasing a shower bench and install a handheld shower head or grab bar. Find a comfortable chair, preferably with armrests and a seat where your hips are higher than your knees, and add cushions or pillows if needed. Prepare and store simple meals that can be easily and safely carried to a table in a bag. Additional things to consider is having good lighting and use night lights, especially if you frequently use the restroom throughout the evening. To reduce risk of falls, avoid low bending by leaving out on the counter items you use on a daily basis. Pain management is an important topic to discuss because control of your pain is our highest priority. Remember, the effects of the spinal anesthesia can last up to 24 hours, so be sure to take it easy when you go home. You'll be started on oral pain medicine during your hospital stay. If you are feeling any severe side effects, be sure to let the nurse or doctor know. You'll be given a prescription for oral pain medications by your surgeon, which should be filled prior to your surgery. To reduce inflammation and pain, it is recommended to rest, ice, and elevate. For patients having a total knee replacement, your surgeon may prescribe a nerve block for additional pain relief. After your surgery, you will be evaluated by a physical therapist a few hours after arriving to the floor. The physical therapist will review with you and your buddy functional activities to determine if it is safe to discharge home. It is vital that your buddy be present during this period in case they have any questions or concerns that can be addressed by the physical therapist. The physical therapist will review postoperative exercises that are very important for your recovery. The purpose of these exercises is to improve circulation, to help decrease swelling, and to promote tissue healing. These exercises include ankle pumps, glute sets, quad sets, and heel slides. When it's appropriate, you will be progressed to stretching and strengthening exercises. In the following videos, I will demonstrate how to safely transfer in and out of bed and in and out of your vehicle. We'll also go over how to negotiate stairs and steps and how to walk with an assisted device. Hopefully these demonstrations will give you a better idea of how to move around safely and reduce the risk of falls. Now let's go over getting in and out of bed after total hip replacement or total knee replacement. If pain allows, try to get in and out of bed normally. You might scoot to the edge of the bed, prop yourself up with your elbows in your hands, and swing your leg over to the edge. And when you're ready to get back into bed, just swing your legs back into bed. If you find that too uncomfortable and you need assistance, you can always use your hand to assist your surgical leg out of bed and back into bed. You can also use your non-surgical leg to assist your leg in and out of bed. And if you still find that too uncomfortable, ask your buddy for assistance. Now let's go over how to stand up and sit down after surgery. Be sure to have an assistive device available to you next to your bed. Scoot to the edge of the bed, and if necessary for comfort, place your surgical leg out in front of you. Push with at least one hand or both hands from the seat for stability. When you sit down, choose a seat that is above your knee but below your buttock for comfort. When you sit down, back up till your legs touch the seat, and again place your surgical leg out in front of you for comfort. And reach back with at least one hand or both hands for stability. Now let's go over how to fit an assistive device. Be sure to stand up tall with your shoulders relaxed, let one arm dangle, and your wrist joint should hit the hand pad. So when you place your hands on the assistive device, you'll have a slight bend in your elbow. When it's time to start walking, be sure to use the assistive device that was recommended to you by your physical therapist. Typically, your surgeon will allow weight bearings tolerated through your surgical leg. Be sure to emphasize good posture, heel to toe, with smooth, symmetrical strides. Now I'm going to review how to transfer to and from the toilet after total hip replacement surgery or total knee replacement surgery. First thing I want to do is back up to the back of my legs, touch the toilet. Then I want to slide my right foot forward for comfort, and I want to make sure I lean onto something stable for safety. Either this counter would be good, or I can lean onto the toilet itself as I sit on down for stability. When I'm ready to get back up, again, I should push with something stable for safety. I can use the counter, or again, I'm going to push from this toilet as I stand back up. And I had my right leg out in front of me for comfort. Now I'm going to go over how to transfer in and out of a car after total hip replacement surgery or total knee replacement surgery. First thing I want to do is back up to the back of my legs or braced up against the car. Then I want to step forward with my surgical leg for comfort. Reach back with at least one hand for the seat for stability. I can reach back with my right hand here against the backrest of the seat, or I can reach back with both hands for stability. Once I'm seated, I can move the walker out of the way. I want to scoot my buttock all the way back. Then I'm going to bring my non-surgical leg in, and if I can comfortably, then I'll just bring my leg in. If that's too painful, I can use my upper extremities for support to bring my limb in and out of the car. Another option is you can use your non-surgical leg to lift your surgical leg in and out of the car. The easiest option, of course, would be just to have your buddy come lift your leg in and out of the car for you. When it's time to get out of the car, make sure you scoot to the edge of the seat first. Have your buddy bring the walker out of the trunk. Make sure you push with at least one hand from the seat. I could either use my right hand against the backrest, my left hand against the seat, or one hand on the walker to stand back up. Now I'm going to go over how to go up and down 2 steps to enter the home after total hip replacement surgery or total knee replacement surgery. First thing I want to do is step up to the 2 steps. If the steps are small enough, I could put the walker up both those steps, or I could angle the walker and push down to stabilize it. I want to go up with a good non-surgical left leg. Put the walker on top of the 2 steps, go up with a good non-surgical leg. And then I can enter the home. If I should have to leave the home, I'm going to want to walk up to the edge of the 2 steps. And I'm going to want to angle the walker and have someone stabilize it for safety. I'm going to want to come down with the surgical right leg. Then when I'm coming down, I put the walker down and come down with the surgical right leg. That's one way of doing it with a walker. The other option is to use a cane. I could walk up to the edge of the 2 steps, put the walker on top, and use a cane for balance. And then I recommend holding on to either a banister or railing or a buddy for safety. I'm still going to want to go up with the good non-surgical left leg. Again, I'm holding my buddy. I'm going to go up with a good non-surgical left leg. Once I'm at the top of the 2 steps, I can use the walker and enter the home. If I should have to leave the home, again, I would want to walk up to the edge of the 2 steps, have my buddy put the walker at the bottom, at the base of the 2 steps, grab onto the cane, hold on to my buddy for safety. I'm going to want to put the cane down, followed by the painful leg down. Cane down, followed by the new surgical right leg. Once I'm at the bottom, have my buddy pass me my walker, and I can leave the cane at the 2 steps, and then I'm on my way again. You want to approach the stairs, get as close to the stairs as you can safely, and leave the walker for your buddy to bring up the stairs. You're going to want to hold on to a cane in one hand and a sturdy handrail in the other hand. You're going to want to go up with your good, strong, non-surgical leg, followed by the cane and your painful new surgical leg. Go up with the good non-surgical leg, followed by the cane and the new surgical leg. So we have the saying, up with the good, up with the good, up with the good. If you have to turn around mid-staircase, make sure you turn while holding onto the handrail. Once you're facing the handrail, you can switch hands, turn yourself around. When you come down, you're going to want to hold on to that sturdy handrail and the cane. You're going to come down with the cane first, followed by the painful surgical leg. Cane first, followed by the painful surgical leg. Cane first, painful surgical leg. So we have the saying, you want to come down with the bad first, come down with the bad first. Once you're down the stairs or at the top of the stairs, leave your cane at the handrail and have your buddy bring your walker. And then you're on your way. When you go upstairs with crutches, you want to approach the stairs and get as close as you can. Put both crutches in one hand opposite the handrail. You can either do it with both crutches together if your hands are big enough to hold it like that. If not, you always can put one crutch horizontal and hold the crutches this way too. Whatever is more comfortable. And the easiest would be to have your buddy bring the other crutch up the stairs for you while you hold on to one. But for demonstrative purposes, we'll put it in one hand here. The other hand's going to hold on to the handrail, and you're going to want to go up with the good non-surgical leg, up with the good non-surgical leg, up with the good non-surgical leg, up with the good non-surgical leg. If you have to turn around mid-staircase, make sure you don't bang onto the wall. So instead, you're going to want to hold them vertically and turn yourself around. There we go. Once you're turned around enough, then you can put both crutches in the other side, holding onto the handrail. So for demonstrative purposes, I'll put both crutches in one hand. And then what I'm going to do is I'm going to come down with the crutch first, followed by the painful surgical leg. Or I can move them together. Crutch and painful surgical leg. Once I'm at the bottom of the staircase, put one crutch underneath each armpit, and then you're on your way. So what are some problems to watch out for after surgery? Excessive redness or swelling at the incision, increased drainage at the incision site, or a saturated dressing. These can be signs of an infection and reasons to call the surgeon's office. Another thing to look out for after surgery are the signs of a blood clot. This includes tenderness at the calf or inner thigh with swelling at the leg, ankle, or foot that does not resolve with rest or elevation. But remember, it is normal to have some swelling, warmth, or stiffness at the joint after surgery. This should gradually improve over the next coming months. Also, to avoid constipation, ensure you are taking a stool softener or laxative of choice to maintain normal bowel movements while on pain medication. We hope you found the following information helpful. Please call your surgeon's office if you have any further questions. Thank you for choosing Hoierppreop Institute.